We are live. Hi, good evening, everyone. This is Richa, and welcome you to our next edition at Family Affair. We've been dying to do this session for a long time. I want to introduce our guest tonight, our speaker, Dr. Swati Arora. She's a dentist and also an implantologist. So, Swati, welcome, and thanks for taking out time at this hour. I know we're all so busy, so this shows the dedication of a medical practitioner. So, let me start with a brief introduction of yours. Please tell us more about yourself and why did you choose to become a dentist?
Okay, hi Richa, and thank you for that introduction, and thank you for having me on your family affairs page. It's a pleasure to be here. So, to begin with, I am a dentist and I am a root canal specialist. So, my specialization is in root canal, and I have also done a course in dental implantology. And dental
Wow.
implants are basically they are titanium screws, just like an orthopedic surgeon does knee replacement and fixes your joints with screws. Same way, if you have a missing tooth, it can be replaced in a number of ways. But the
Okay.
latest thing is not to give you something which has a plate like a denture that we all remember maybe our grandparents wearing.
I know.
That is
Yeah.
a yeah, so that is a removable replacement, and another is a fixed replacement with the help of your adjacent teeth, the healthy teeth which are
Okay.
next to the healthy teeth which are next to the missing teeth. They are taken as support.
Oh,
you know
wow.
अगर मैं सिंपल
Like
टर्म्स में समझाऊं,
support.
हाँ,
Yeah.
तो फ्लाईओवर बनता है ना, तो दोनों तरफ आपको कॉलम्स चाहिए, फिर उसके ऊपर गाड़ी जा सकती है. So
Oh
to
my
replace
God.
so to replace one tooth that is missing, you need support of two healthy teeth. So that
Oh,
used
wow.
to be, yeah, so that used to be a bridge. That's called a bridge. But then with advancements in dentistry, they realized that why should we cut healthy teeth or touch teeth that are healthy to replace a tooth which is gone. So
Okay.
then came in dental implants. So they are basically titanium screws that we place inside your bone. So
Oh,
that
wow.
yeah. So that screw acts like your root, the root of the tooth, and on top of that we give you a cap. So for
Okay.
one tooth you get one implant, and you don't sacrifice healthy teeth.
Oh, wow. In fact, I was seeing one ad where, there's new kind of, braces which have come in the market which are invisible. I said, wow,
Invisible.
things have,
Yes.
really changed. I think technology is also helping us move forward. So, Swati, I wanted to, begin by asking you about milk teeth. We keep hearing about, so I want to know how important they are because, eventually they do fall out. So, can you tell us a little bit more?
Yeah, absolutely. And since this is a page which is dedicated to family and parents, so I would like to stress that now times are changing. There was a time when we were younger and parents used to believe that doodh ke daant hai, inko nikal do, they're of no use. But
Yeah.
that's not the case. See, first of all, teeth are most important for your appearance. You know, your smile is the gateway to your heart. So whether it is an adult or it is a young child, if they don't have teeth, they'll not have the confidence to smile, and that child will not build his social skills. you know Other than that, the other thing is that the milk teeth, they provide the erupting pathway to the permanent teeth to come in proper place. So if we extract or remove milk teeth before their time is up because of any decay, then there is a very high likelihood that the permanent teeth will come out in a different place, or they will be slightly, you know aage piche, they will be malaligned.
Mera, mera, yeah, that's as we
Right.
call it.
So we increase the chances of malalignment of mixed milk teeth, permanent teeth, if we remove the milk teeth. So
Okay.
it is very important. And the last thing is that as long as your milk teeth are there and the child is learning how to speak, so they're very important for good phonics development.
Okay.
When we talk certain words, our tongue touches the palate, sometimes it touches the teeth. So for proper phonics, the proper teeth, the milk teeth in their proper places is very important.
Oh, wow. So, thanks for sharing that because, we all have, kind of heard so many things. And as they say, there's a lot of, hearsay. So, thanks for the clarification. I now wanted to ask you, how do we clean our child's teeth? Because, we hear about oral hygiene and best practices. Please fill us in. What's the best way to, go forward?
See, good oral hygiene or care for the child's teeth begins at the time of birth. So when the child is born, there are no teeth in the mouth, but the entire oral cavity has teeth present.
Hello. I think we lost Swati over there. Let's wait for her. So, guys, if you have any questions in the meantime, do let us know. We will take them up. Swati, guys, we'll be right back. Let me just fix this. I think there is some internet issues. So in the meantime, let me just fill you in about our latest initiative. We have restarted our talks. So if you want to hear about any topic which you think is pressing for you and you need to know more information related to kids and families, so do let us know. We'll invite our experts and try to fill you in terms of the latest information. So coming back to our latest issue here, I think for every parent, it's more important to maintain all kind of hygiene, especially oral hygiene. Because I remember when we were younger, our parents used to say, "Do bar brush karo, gargle karo, take care of it. Eat, don't eat too much of ice creams, don't eat too much of sweets because it will lead to decay." So I'll come back again once Swati joins us. I think there is some issue at her hand. So allow us some time. We'll be right back. Thank you. Okay, guys, we are back. Sorry for the
I'm so sorry,
internet
so
issues.
sorry.
No
We
issues.
had a
Late
power
at night.
failure.
No, I think, but we're still at it. So, Swati, if you would like to continue, about the oral practices and hygiene, how do we clean our children's teeth?
Yes, so I was wanting to tell you about how to care for the child's teeth. And I was telling you that care for the child's teeth begins at birth, even though at that time there are no teeth in the mouth. But we must clean the tongue and the other soft tissues. So for that you need a soft moist cloth, जैसे कि दादी नानी बताती हैं. Or nowadays gum pads are available that you can just wet and slowly rub over the tongue, the lips, and the cheek, etc., to keep those areas clean. The teeth start erupting at the age of 6 months, and generally up to the age of 2.5 years, the milk teeth are erupting. From the moment that the first milk tooth erupts in the mouth, we can take a soft child's brush and we must teach the child how to clean the teeth. In the beginning, it is the parent's responsibility to clean the teeth, right? Till the child is able to do that. At this stage, the toothpaste is not important, You just need to wet the bristles, and the action of cleaning is important. The mechanical motion
The
rather
method.
than putting in a toothpaste. Richa, the actual recommended amount of toothpaste for a child is just a size of a pea, matar ke dane jitna.
Okay.
Okay, so the paste is more for the feeling of freshness.
For
It's
the,
the
yeah.
mechanical cleaning that you're doing and the rinsing that you're teaching the child that is causing the cleaning.
Oh, wow. So, in fact, I've seen for younger kids, we have toothpaste in the market which one swallows, you don't need to rinse it out. So, that's also there. I think it's more, as you said, it's more about the rotary motion and the mechanical cleaning than actually the toothpaste which is required. right?
See, a lot of it is commercial to get the kids into Spider-Man and Barbie.
I know. And the glow in the dark Colgate series, I've seen that. I think is more a marketing gimmick. So, Swati, I wanted to ask you another question. Do
I
milk
can't hear
teeth get
you.
Can you hear me now? Hello? Can you hear me now? Can you hear me, Swati? Let me come back again. 1 second, guys.
Richa, I'm not able to hear you.
Swati, can you hear me? Am I audible now? Am I audible?
Richa, am I audible?
Yeah, you are. I can hear you. What about me? I'll go
Yeah,
live
but
again.
very, very low.
Now, is it better? I'll just come nearer to the screen.
हाँ, but बहुत धीरे आवाज आ रही है.
Okay, let me ask you my next question. So, do milk teeth get cavities? Do milk
Yeah.
teeth get cavities?
Yes. Yes, milk teeth get cavities. And the most common type of decay in milk teeth is nursing bottle caries. You know, as mothers, we tend to give our child a bottle of milk and put them to bed.
Yeah.
It's easy and convenient. And most of us also start putting a little bit of sugar in that bottle, as the child becomes 1.5. So once the child is having a bottle to suck on and he's sleeping with that milk bottle, all the milk gets stuck on the teeth. So the most common type of decay in milk teeth is called nursing bottle caries, and that happens generally in the front teeth. And it's just because of the habit of the bottle, which should be, given up once the child is 1 plus and he has started taking in solids. Then this habit of giving milk at night should be discontinued.
Oh my God. We didn't know that because, I see a lot of kids, using the bottle till a very
Yeah, up
late
to the
age.
age of 2, 3, even more, mothers are giving bottles to the children.
My God. Okay, we have a very interesting question. Sabah has asked, my kid recently lost two of his milk tooth on both the sides. Now he's facing chewing issues. What can be done?
Can you
Her,
just repeat it, please?
her kid lost his milk teeth, two of them, and now he's facing chewing issues. So what can be
How
done
old
about
is
it?
he?
He's 9 years old.
He's 9 years old and
Yeah,
he's lost two of his milk teeth.
yeah.
So at 9 years, I assume that the milk teeth that he has lost are the ones that are at the back. They are the molars. Because from 6 years onwards, our front permanent teeth start to erupt. So he is obviously facing chewing problems because the teeth that are supposed to come in that region will come at the age of 11 to 13. All
Okay,
right. So ideally at this age, if he has lost his molars and he is not getting anything done, then we give the child space maintainers. That's actually a small wire which is adapted and placed in that area. The child gets used to it. It's not a very uncomfortable thing, and that gives space to the new teeth to come.
okay,
All right. As for chewing, behind these teeth, his new permanent teeth will be erupting soon.
okay.
So that issue would be sorted.
It will go away on its own with
Right
time, and I
now, they
think,
should focus more on trying to maintain that space where they have lost a tooth.
okay, great. I also wanted to ask you, like, at what age should we actually start visiting a dentist for our kids? Because, we usually, Indians, we wait for things to happen and then we're like, acha, ab chalte hain. So, as a regular
Hmm.
practice, what's the right age to visit?
Yeah, that's a very good question, Richa, because you're absolutely right that it's only in India that we have this trend कि जब तक कोई problem नहीं होगी, किसी भी डॉक्टर के पास नहीं जाना, and dentist is the last one to go to. So you see, child develops a phobia of the dentist and the dental chair because here the children are not exposed to going to a dentist. Here they are only exposed to going to a pediatrician, and that too only for vaccination. not for any other reason,
Yeah.
right? But ideally, once the teeth start erupting, which is as early as 6 months, so from the first year of the child, you must take the child for just screening visits, for the child to just get adjusted and used to going to a dental clinic. And also for the dentist to generally uh, have a look at the child's oral cavity, at the developing teeth, and also to develop a
Yeah.
relationship with the child. The most important thing with children is that they should have a relationship with the doctor.
Yeah. Also,
I'll tell you an interesting story in this context, that
that,
I actually wanted to be a doctor.
okay.
I wanted to do MBBS. But all of my school life, from class 7th till class 12th, I was constantly visiting the dentist.
I remember
First
your
for
braces.
braces, and then braces. Then he extracted some teeth for braces, and then he told me, "ये braces से पहले cavities fill होनी है." Everything was going on. So वो dentist के यहाँ जा जाके ना, and I used to find the chair very interesting. ऊपर हो जाती है, नीचे हो जाती है, पानी आता है यहाँ से. So it's actually, if you play with the child and you tell the young child also, they lose their fear. So
Wow. Yeah.
I actually,
Sure.
because of my frequent visits to the dentist, I decided that rather than doing MBBS, I would love to be a dentist.
Wow. That's a good one, कि चलो अब मैं ही बन जाती हूँ. I'll take care of all the issues. That's so sweet. So
Yeah.
also I wanted to ask you, what there's so many brands of toothpaste in the market, both for kids and for adults. For kids especially, what are the good brands? Because as you said, it's a marketing gimmick. And I'm sick of hearing क्या आपके toothpaste में नमक है. I know. But coming back to kids, will you recommend some brands which you feel are actually, can help in any possible way? Is there any merit?
See, Richa, any toothpaste is okay. The child must know how to spit it out and brush properly.
Okay.
And unless indicated, or you live in an area where the fluoride content in the water is too high, you do not need to buy a toothpaste with fluoride in it. Okay.
Okay.
But having said that, in India, Colgate is a very trusted brand which has been there for years. So
Okay.
you can go in for any Colgate toothpaste.
My son is addicted to his Motu Patlu and Glow in the Dark Colgate series. And but as a mother, I used to buy
Same
Sheetly
here.
because I used to find, they had, softer bristle brushes. The whole range was quite nice. So, but yeah, so I think
Yeah.
Colgate is the one which you are recommending. So I will also, buy only Colgate now, and I'll recommend all our parents to also go for Colgate. I have another very interesting question. What is the right size of brush for kids age 9?
The
Size
size
of
of
the
the
brush?
brush.
Yeah, which brush should we go for? Like, but there's so many medium,
No,
large.
again, see, I want to say that I don't recommend any brands. But children generally like colorful brushes, that आजकल तो सभी brands के हर तरह के brushes आते हैं. In fact, power tooth brushes भी आने लगे हैं, Oral B वगैरह के, for kids, which are very good. So I also recommend powered toothbrushes.
I have that for my son because it
Yeah,
kind of we
yeah.
got
So
him
the
into
cleaning is much
brushing it
better.
twice. What about gargling? What about your mouthwashes?
No, no, I do not recommend mouthwashes to kids, especially not at all, because they have a tendency to gulp it down. And even to adults, I would advise that, see, all these things are medicated. I do not advocate unnecessary use of any medicament in any form, even if it is just a mouthwash, unless you
Okay.
have some condition where the dentist feels that you require a mouthwash to see. The oral cavity has a normal flora. There are a lot of microbes in the oral cavity which are normal commensals. By that I mean that they live in the oral cavity and they're supposed to be there. They're good
They're supposed
bacteria.
to be good. Yeah, they're good
So
bacteria. Yeah.
unnecessary, we do not recommend that you use a mouthwash for no reason. Water rinsing is as good as anything else. In
It's the
fact,
purest form.
90% patients, I tell them, have water with salt. Even if you have, gum issues, do garam pani mein namak dal ke kulle. That is better than anything else. Any Listerine, any betadine, anything.
I think all this, Dadi ke nuske is the ones which really, it has a merit. हम भी like सबसे पहले मुझे भी लगा कि बस salt is the best thing to add to your
Yes.
gargle water if at all.
Yeah.
Wow.
Actually, आजकल holistic या whatever is natural is better. So unless recommended by a dentist, please do not go in for any medicated toothpaste or a mouthwash.
Okay.
Prolonged use of anything is not good.
Okay, great. Swati, last question before we, part ways. Uh, we want to brush in the morning and also at night. That's what we've been hearing. I mean, what will you recommend as a oral, hygiene practice? So, as you said, the toothpaste doesn't matter. It's the rotary skills, gargling with saline water or plain rinsing. So, can you just end with that? What should be, some checklist for parents to make sure that we are on the right track, apart from visiting the dentist
Yeah.
on time. So please take note.
No, I definitely say that please brush in the morning and please brush at night too before going to bed. Because the main cause of any decay is the food that is stuck to your teeth. And these days, sorry to say, my own kids, if I look at them, they are so used to, uh, you know, they're so used to watching TV and eating food that half the time they don't wash their hands before starting to eat foods, and they rarely get up and rinse their mouth once the food is over. I'm talking about my own kids. So that's why I highly recommend that teach the child how to rinse. They have so many snacks, they have so many things to eat during the day, food that are sticky, biscuits, and all refined sugars. So the child should be taught that even if he's not going to the wash basin, he should take a glass of water, just swish that water in his mouth and take it inside. At the end of the day, it is the food stuck in our teeth or staying in the oral cavity that causes the decay and allows the growth of the microorganisms. So
Okay.
please, first and foremost, please encourage the children. When I go for school camps, I always tell them that you are eating your tiffin in school. So ideally, the teachers always send the children to the washroom to rinse their mouth and wash their hands. But if the children are not doing that, I always tell them that take your water bottle, swish the water in your mouth, and take it inside so you have cleaned it of any food debris.
Oh
And
wow, that's
number
a
two,
good
we
point.
must encourage our children. Yeah, we must encourage our children and us to at least brush once before we go to bed. You know.
Wow, cool. That is something which is really essential. So thank you so much, Swati, for taking out time. I know you've been terribly busy with the long, work day. So guys, Dr. Swati Arora will be, aligned with us. She'll be having a weekly expert talk, anecdotes and tips also. She'll be sharing with us going forward. You can consult with her one on one and take an appointment, and don't wait for things to happen before visiting. I think the learning for me today, apart from the vast knowledge which Swati shared with us, is about visiting a doctor well ahead in time. So thank you so much, Swati, for your time. Wish you all the best, and thank you for partnering with us. We look forward to more sessions, and have a
Thank
good
you
night.
so much, Richa.
Thank
Thank
you.
you. It has
Have a
been
good
such a
day,
pleasure.
everyone.
I apologize for the power cut जिसकी वजह
No,
से
not
बीच में
at all.
गड़बड़ हुआ. But I hope to be available for any queries. Thank you
Of
so
course.
much.
And we'll leave her details so you guys can, connect with her. Thank you so much, Swati. Have a good evening. Thanks, viewers. Keep in touch, and we'll be back soon. Good night.